Thank you so much for inviting me to speak. I'm going to talk a little bit today about a project that was funded by the National Center for Atmospheric Research up in Boulder, hence the Colorado connection. And this project was originally research on evacuation and different kinds of impacts to communities after fires. We went out to interview folks after the Marshall Fire, and we got talking in a lot of these conversations about what smoke damage looked like, how people are navigating it. I've been doing research in this kind of space for 10 years almost now, and these were conversations I really hadn't experienced before around smoke damage. So I'm excited to talk a little bit about that work today. So before I dive in, I think it might be helpful just to make sure we're on the same page around this conversation on smoke damage. There is a growing but small amount of research that really documents the differences in what kind of chemicals are put out when we burn vegetation versus when structures are burning. Obviously, the latter is not ideal, and we're talking about chemicals from building materials, from things inside of houses, from cars. So it's a lot more complex, and there's a lot more questions about what that means health impact wise for the public. And this is a really big question that's starting to grow as we get more of these maybe more urban fires in California, in Colorado, that are rewriting what it looks like to recover from fire in multiple different ways. So lots of unanswered questions, some that stand out to me. We don't really have a good idea yet about what level of smoke damage is safe or unsafe to live in a house. We also don't have clear guidance yet on how to remediate a house, so how to clean it up after it's been impacted by smoke damage. So lots of question marks on the process. And then we also don't have a good idea yet of how recovery experiences vary between folks who've been affected by fire and lost their house entirely versus this kind of smoke damage question mark. So for better or for worse, the Marshall Fire is a good case study for this question. That is because if you look at aerial photos, things like that after the fire, you see a lot of what looks like this on the ground. Houses that are destroyed, and then there might be one or two or one street here, one street there. Well, houses are still standing. But when they did smoke plume analyses after the Marshall Fire, it showed that some of these houses were in really heavy smoke for maybe between 12 and 18 hours during kind of the peak of the fire. So there was a lot of material coming into these houses, and that's Teslas from next door. That's the fridge from down the road. That's the houses 2 blocks away, all kind of centering on these standing homes. When we talk with folks out here, I just want to acknowledge they refer to themselves as standing home families, the people who have these homes in the middle of burned areas. So that's their preferred term. I'll refer to them as that. And we think possibly there could be up to 1,800 homes that had some level of smoke damage after the Marshall Fire, although I don't know that there's really clear documentation. That number comes from the number of insulation replacement permits on existing homes in the year after the fire. So hard to know how much smoke damage there really is out there after fires too. I mentioned that we were funded by NCAR up in Boulder. They had us out for quite a few months over the last 2 years. So we've been there at least 2 months of the past 2 years. And this data collection happened, or it started, the bulk of it happened in March of 2023. So just over a year old and just over a year after the fire as well. We met with about 54 folks during that time, and these were people who were local professionals, county leaders, fire departments, health professionals, and then we were also talking with residents across the burn area in Louisville and Superior. And that was actually quite a big spectrum too. We did meet with folks who completely lost their homes. We had partial losses. We had smoke damage folks, and there's a gradient there I'll talk about in a minute. But it let us compare what these impacts look like for different people after the same fire. So this presentation today, I want to kind of high-level review some of these best practices that were emerging from these conversations about how do you deal with smoke damage after a fire and what does that look like. And then I'll close out with just a few suggestions for how we might work together to make an impact for the next fire. So the first recommendation I'll pull out is to prepare for and communicate for a spectrum of impacts. I mentioned that we were interviewing folks across that spectrum, but a lot of people really didn't know what they were looking for when they came home to their standing homes. They knew their house was standing, and in theory, that's the end of the conversation, right? But they were moving back in, not noticing char on windowsills or not knowing to look for it. And some of this particulate matter is really, really microscopic, so it might not be super visible to the eye in the first place. That led to folks saying, well, I got a boil water notice equivalent when I re-entered my property. Could there be something similar for smoke damage? Or could someone at least tell me to take a look, think about this when I open that door for the first time? And this is really important because a lot of folks talked about when they call their insurance company, they maybe moved back into their house, were in there for a week before they kind of noticed, hang on, this isn't quite right. Well, as far as the insurance companies were concerned, it seemed like if you moved back in, then it was appropriate to live in. So it was a much more challenging back and forth to justify why you needed their support afterwards. That is also important because this smoke damage spectrum is way, way broader than we first expected to. So we met with people who would just go in and wipe down surfaces in their house with a damp cloth, and that was the end of it. We also met with people who were in multi-month-long conversations with their insurance companies requesting that their house be demolished because the smoke damage was so severe that they didn't feel safe living in it and they didn't feel comfortable selling it. So we're talking about very, very different ideas about what smoke damage can entail in these places that we need to be planning for ahead of time. Okay, related to that, because there's not a lot of information out there, it's a good idea to start to figure out what resources can we provide based on how little we know about smoke damage and how rarely it's integrated into pre-fire discussions in the first place. First really big challenge to this is there's actually no clear bar for concern. What is a concerning amount of smoke damage versus something that you don't need to worry about? No clear cutoff there. And some folks were saying any amount of smoke damage should be the cutoff. Even the smallest trace should be a conversation. One of the challenges around this is it's really difficult to get your house tested for smoke damage after a fire. So a lot of the people we met with were saying, I had to beg with my insurance company, or I had to find really sneaky ways to appeal to them to get them to pay for this air quality test in their house, for example. And the few people with standing homes who did get those tests ended up sharing their results with other neighbors who had standing homes. And they would use it kind of as a proxy. So if this person down the street had all these issues or these chemicals, pretty good chance that you did too. And that's not an absolute kind of like kind situation. There's a lot of variation, but at least it was a starting place. The other challenge with this kind of testing situation is what is the right test to demonstrate that you have smoke damage? Really early on after the Marshall Fire, when people were working with their insurance companies, their insurance company would set up a air quality monitor in their house. But in the kind of days to weeks after a fire, all that particulate matter starts to settle. So while the air quality might be good, the material on the surface is not. So people are really starting to advocate, yes, air quality testing, but also kind of swabs on the surface that can be sent away to test too. So lots of questions on how to demonstrate you have this need. Our third takeaway from this is having the ability to highlight reliable resources that reduce uncertainty for those folks with standing homes. So I mentioned there's not a huge amount of information readily available on this topic. And in the kind of Boulder, Superior, Louisville area, there's a lot of research institutions. So a lot of the people we met with had PhDs or were really in the science community. First place they went to, peer-reviewed literature. So they're searching on Google Scholar to see, well, what's the story about smoke damage and what do I need to know about that? The challenge came in this kind of gray area between, okay, there's a study on this kind of smoke impact, but it's not quite the same as me, or it's in a different kind of environment. What is that gray area between and how they translate that situation to their own? So this led to some really kind of time-consuming investigation. And I like this quote on the top right here. one interview, he called it the smoking rabbit hole. Every piece of information leads to a new piece of information, and then you're just non-stop finding new challenges or questions around this topic. And this actually ended up in a lot of, I think, underlying mental health issues for a lot of folks out here. There is no clear answer, and that's really challenging to grapple with. This also, over time, kind of led to this distrust in any kind of information if it's coming from a public source. These folks know so much about the uncertainty now that it's really hard to believe a single source of information would be credible or correct when there's so much gray area around this. The fourth point I'll touch on kind of builds off these first three, which is we really need a national standard for what we consider clean after a fire in terms of smoke damage. A lot of these insurance company challenges really lent on this lack of standards. So there's no guidance that says, yes, this is clean enough to live in again. And insurance companies would go in some cases and do the bare minimum. In other cases, they do a lot more. But there was a big spectrum there, and the response people would get from insurance companies because there was no standard for remediated. And then this was kind of a pretty big fire event. Insurance companies are sending folks from Louisiana, from Oklahoma, and they're using remediation methods that maybe aren't suitable. So it might work in a flood or a tornado, but it's not going to work here. And one example is them bringing in industrial fans to kind of clear out the air. Well, in doing that, that stirred up all these particular situations on the surfaces and kind of impacted the home. As a result of that lack of kind of clear standards on what is and isn't clean, the insurance conversations that people were having when they had smoke damaged houses were lasting so much longer than those folks who had lost their homes completely. It was really clear in a structure loss. The structure's gone. Yes, you're eligible for 1, 2, 3, 4 things. And of course, it's not that streamlined or straightforward, but it was there was more of a process to follow there. With all this gray area around standing home, there was a lot of kind of, well, prove to us you have this, but we're not going to pay for testing, or, okay, you've got that, but we're only going to give you these things. So it became a much more drawn out process for these kinds of populations. And then the last big picture takeaway is to really acknowledge and include the standing home community in these post-fire discussions. A lot of folks felt left out or kind of an afterthought in the grand scheme of things. And originally that made a lot of sense to folks, right? They knew they had their house standing and they stepped out of the way so that people who did lose homes could speak up and access resources. But because there was so much unknown about smoke damage, as the months passed, it became more apparent that actually smoke damaged home families are in a worse situation than they thought. And now there's no resources for them because they weren't included at the beginning. And that's not a knock on anyone involved in the recovery. This is a real unmet need that hadn't come to the surface in a lot of fires before. So they weren't eligible for FEMA assistance. They weren't eligible for foundation funds, things like that, because of the pre-existing idea we had of what destroyed means after a fire. So it's not always all the walls are gone and the house isn't there. It's destroyed in a different way with smoke damage. This lack of kind of formal support structure led to a lot of that self-guided research I talked about earlier, especially around insurance companies, but it also led to a lot of community building. So there was lots of support groups, Facebook groups kind of emerging in this standing home community, just so rich with information and conversations and questions that I don't think we see after many fires. So I'll kind of wrap up that interview takeaway portion with this quote, which I think really summarizes a lot of what we heard. In the beginning, it was really clear what folks who had their homes destroyed had lost, but it wasn't clear with smoke damage. People were kind of saying, wow, you got lucky in this situation. Well, now the recovery process is so much longer. It's so much more challenging than maybe we'd expect for a smoke damaged standing home member to have. I would say almost every interview ended with, I really wish my house had burnt down because it would have been a lot easier that way. And if we're hearing things like that, that we really need to listen to that kind of a conversation. That's a really striking conversation to have. So I want to close out with a few slides on what can we do to implement these findings, and maybe if there's time, we could talk about the nuances to those. But before a fire, I think there's a lot we can do to prepare for these kinds of situations on the back end. First big one, developing materials about how to identify smoke damage, and that might be photographs of different kinds of smoke damage, might be information about what kinds of tests to get for what kinds of chemicals you might expect in your house, just some overarching guidance. And then the same thing for cleaning and remediation. A lot of folks opted to do it themselves before realizing they needed to get insurance involved. Let's talk about how to know if you need insurance involved. And then if you're doing it yourself, what are the right techniques for that? What PPE do you need? Then I think there's a lot of space to at least have conversations about what smoke damage might need to be represented as in pre-fire planning. And that could be communication on re-entry. If we're sharing information as folks with standing homes come back in, what do they need to know? And then the availability of relevant resources. And that could be a list of trusted remediation companies who have experience with smoke damage. It could be a whole assortment of things, but putting out ahead of time, here's who we trust or who we think will be able to help. Then in that after fire space, I think this whole presentation is kind of a call to think more broadly about what we define as loss after fire. It definitely means a lot more things than just destroyed and smoke damage too. There's water quality impacts, there's vegetation loss and a loss of sense of place or place attachment. But this smoke damage one is definitely a contender to be in those conversations. When we communicate at public meetings after fire, in the Disaster Recovery Center, any place we're interacting with folks, vocalizing that smoke damage is a valid impact is really important. A lot of these folks we met with felt like, I can't really say anything, this isn't a real impact, or it's not a high priority impact. That led to them being disconnected from resources down the road because they didn't feel like it was right for them to speak up at the time. We can help with that by validating that as a loss early on. Then, to the best of our ability, wherever we can include standing home families in recovery assistance and funding. Obviously, a lot of these funding pots and grants come with really stringent, kind of strict guidelines on who can get what. But if there are places with wiggle room, that could even just be Red Cross assistance on day one after a fire, having those conversations about where might we be able to include them. And then long-term, thinking about avenues for mental health support. These insurance battles were really, really traumatizing for a lot of people, and in a lot of cases, more traumatizing than the fire itself. What kinds of support can we provide? And United Policyholders came up a lot as a great resource in these conversations. But how can we also round that out with well-being support as well? Then at the high level, what can we ask of policymakers if we get their ear? There really does need to be a national standard that's put forward, and that could be through the EPA or a whole host of other appropriate places. It sounds like there are starting to be moves around this that will be really, really helpful for folks down the road, but having those standards and then pairing them with training in the insurance industry and for industrial hygienists, the people who come and test these properties afterwards, so that they really have a good idea of what they're looking for, because this is a little bit more of a unique impact after fire. So I'll end here by saying I'm not an atmospheric chemist or a particulate matter expert, so I can't really speak to the extent to which these concerns around smoke damage are valid. But whether or not there is risk, it's really important that we listen to these folks. They're feeling left out. They're facing recovery journeys on their own. Really important to at least have these conversations and incorporate them in wherever we can. So I'll wrap up there. And please feel free to reach out, send me an email. I would love to talk about this. I'm working on the probably not very interesting academic paper to go with this data now. But I'm always looking for ways to advocate and help folks out on the ground too. So please don't hesitate to shoot me an email.